In the healthcare environment, it is likely that we will encounter people with various conditions that we will need to work around. While the massage application itself does not change, accommodation that we would make is important. Allow the client/patient to be able to teach us about what it is that they have, how they have accommodated, and what we need to do to make their massage session more appropriate and more comfortable. Our client here has spinal bifida and is explaining to the massage therapist what she will need to do in order to make him comfortable, help him move about the table, and position himself so that he is protecting areas that need to be protected and as comfortable as he can get. Once the person is positioned, then you would go about your massage techniques as you would for anybody else. Again, working around, as in this example, braces, or any areas of caution, such as spinal bifida, areas within the low back area. If a client is incontinent and wears protective clothing, just make sure to be aware of the modesty and drape over the area. Allow the client to explain what help they need and only offer assistance when asked. It is very likely that the massage therapist working in the healthcare setting is going to encounter individuals with diabetes. Our model here is showing us an insulin pump that she has, which would fall under the classification of a medical device, that we would have to learn to work around and understand how the device works. When working with the pediatric population, it is important to make sure that the parents are present. Often children are hesitant to let the massage therapist work with them. By demonstrating with the parents, we're often able to encourage the child to let us work with them. If this does not occur and the child does not allow you to touch them, then teach the parents some simple massage techniques that they are able to use with their child. When working with the older child or adolescent, they are much more willing to cooperate with the massage therapist. Again, always make sure that the parent or guardian is there and talk to the child. Allow them to explain as much as they can to you while also interacting with the parent. Adolescents and children are often more comfortable if they leave most of their clothing on during the massage. And again, teach the parent how to do some of the methods themselves. The elderly will make up a large portion of the population that we work with in the healthcare setting. Elderly clients often have complex conditions with more than one situation to evaluate. Our client here is being seen for backache, but also has psoriasis, which makes it interesting to be able to decide just how the treatment plan needs to be prepared for them. Again, the general massage application remains the same, but we have to stop and consider all of the various things that occur as a person ages. We may have to adjust our depth of pressure, the amount of drag that we apply to the skin, the duration and intensity of the massage. Our patient has psoriasis on her leg, but the skin is not broken, therefore it is appropriate to massage over the area. Be cautious with the elderly when utilizing range of motion techniques, muscle energy techniques, and any type of muscle testing. Watch for areas of regional contraindications such as this hernia. There is also a scar in the area, making working in this area much more complex. Constipation can be very common in the elderly, and as demonstrated, massage around the area of the large intestine may support peristalsis. The area of psoriasis on the abdomen appears to have some areas of broken skin. Therefore, we would stay away from the area, treat it as a regional contraindication to prevent infection. Gentle rhythmic rocking is also comforting. Pay special attention to the modesty of the elderly client. And provide assistance on and off the table. If a patient is using a wheelchair, accommodation will be made in how the massage is provided. It's effective to use techniques for seated massage. Again, identify areas of contraindication, such as the cast area. Even though there is a caregiver present, talk to the patient directly. Make sure that the client is warm and teach the caregiver methods that they can use on a daily basis. The focus here is to encourage fluid movement in the leg that has the cast. We're using passive range of motion. Ongoing feedback assures that we are providing the type of care that the client enjoys that is also effective. Working with the unaffected side can support fluid movement in the leg that has the cast. Supporting the leg on the pillow as we kneel in front of the wheelchair is an effective way to do this. Ask first before removing shoes or socks. And continue to explain to the client and the caregiver what you are finding in your assessment process. It's very common when somebody is in a wheelchair that they will stiffen up in their neck and shoulders. Even if this is not a specific target area, it's always pleasurable to have a little bit of massage work done to provide comfort care. Palliative care is a very important aspect of massage. Observe for skin areas that might require accommodation to the massage. This patient has a wound on her arm from a fall. It's in the subacute stage of healing. We can use our wound treatment methods to encourage the edges of the wound to heal by pushing together. This type of application also keeps the forming scar tissue pliable. It would be inappropriate to pull the wound edges apart at this stage of healing. The bruising is a result of IVs. We can use simple skin drag lymphatic drain over a bruised area. Always maintain professional therapeutic boundaries, but also be open for a hug.